Ginger, that aromatic root that adds a spicy kick to dishes worldwide, is renowned for its impressive health benefits. From soothing nausea to reducing inflammation and boosting immunity, this natural remedy has been used for centuries in traditional medicine. Its potent compounds, like gingerols and shogaols, pack a powerful punch when it comes to improving your overall health. But did you know that some people should avoid using ginger completely? Despite its reputation as a health booster, this zingy root isn't for everyone. In fact, for certain individuals, consuming ginger could lead to unexpected and potentially serious health complications. In this video, we'll uncover the surprising truth about ginger, and we will reveal to you which health conditions don't mix well with this popular spice. You might be shocked to learn that your go-to natural remedy could be doing more harm than good. So stay tuned to discover if you're among those who should think twice before reaching for that ginger tea or supplement. Now, without any further ado, let's get to it. Number 1. Gastroesophageal reflux disease. Gastroesophageal reflux disease, or GERD, is a health condition in which the stomach acid flows back into your esophagus, which is a muscular tube connecting your mouth and the stomach. This condition must be managed immediately as it can lead to severe complications such as esophageal ulcers, perforation, and even tumors in severe cases. One of the steps a patient suffering from GERD must take is to avoid the consumption of ginger. Ginger can increase acid production in the stomach and relax the lower esophageal sphincter. Normally, this sphincter closes the part connecting the esophagus to the stomach and prevents the acid from flowing backwards. If this sphincter is defective, then the corrosive acid will be allowed into the esophagus. In GERD patients, this can exacerbate symptoms like heartburn and indigestion. Studies indicate that while ginger can aid digestion, its effects on lower esophageal sphincter relaxation can worsen GERD symptoms. In a study conducted in 2008, healthy volunteers were given ginger capsules. Questionnaires were used to monitor symptoms of GERD. It was found that ginger worsened the GERD symptoms in 40% of participants. Number 2. Bleeding disorders. Ginger has antiplatelet or blood-thinning properties, so it's best to avoid it if you suffer from any disorders that make you more prone to bleeding. Ginger can inhibit thromboxane synthetase, which is a crucial enzyme for platelet aggregation. Platelets are small cellular fragments that stick together to stop the bleeding. Anything that affects the aggregation of platelets can result in uncontrolled bleeding. Now, not only will ginger inhibit the enzyme responsible for platelet aggregation, but it also can decrease the levels of clotting factors and prolong bleeding time. This is done by gingerol, which is an active component in ginger. These actions can exacerbate bleeding disorders, such as hemophilia, or increase the risk of bleeding in people on anticoagulant medications like warfarin. Studies show that high doses of ginger can significantly reduce platelet aggregation, leading to increased bleeding risk. A study was done to prove these facts. In this study, gingerol was isolated from ginger. Then the effect of gingerol on the thromboxane synthetase enzyme was tested. The results were determined by measuring platelet aggregation in human blood samples. According to the results, platelet aggregation was reduced by 60 to 70% with gingerol treatment. Number 3. Diabetes. It is best to avoid eating ginger if you suffer from diabetes. This is a condition where the patient suffers from persistently high blood sugar levels, usually due to a defect in insulin production or response. The most common management for this condition after diet and lifestyle changes is the administration of medications to help lower the elevated sugar levels. Some people recommend that diabetic patients consume ginger as it can lower blood sugar levels. However, the problem with this advice is that ginger might interact with diabetes medications and lead to hypoglycemia. Hypoglycemia describes incredibly low blood sugar levels that come with symptoms such as dizziness, confusion, and fatigue, but rapidly progresses to more serious complications if not addressed quickly, one of which is coma. The mechanism ginger lowers blood sugar levels is by increasing the sensitivity of your body cells to insulin. This increases the glucose uptake by muscle and fat cells and consequently lowers the sugar levels in the blood. A 2015 study published in the International Journal of Food Sciences and Nutrition demonstrated the effects of ginger on blood sugar levels. In this study, type 2 diabetic patients were given ginger supplements, and their fasting blood glucose levels were measured in addition to changes in their insulin sensitivity. After analyzing the results, it was found out that their fasting blood glucose levels decreased by 12% and insulin sensitivity improved by 15%. So, while ginger consumption is beneficial for managing blood sugar levels, it can be dangerous for diabetic patients on medication, potentially causing their blood sugar to drop too low. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Gallstones. If you have gallstones, it's not recommended you consume large amounts of ginger or food that contains ginger. This is because ginger stimulates the production of bile due to its high content of gingerol and shogaol. For people with gallstones, this can be problematic because increased bile flow can exacerbate the condition by causing the stones to obstruct the bile ducts. The unfortunate result of this would be pain and potential infection. If the bile ducts are obstructed, then the bile will accumulate inside the bile gland. The bile represents an ideal medium for the growth and division of the bacteria inside the bile gland, leading to cholecystitis. Cholecystitis is the medical term used to describe infection in the bile gland. Clinical observations suggest that ginger might cause more frequent or intense episodes of gallstone pain. Numerous studies were done to test the effect of ginger on gallbladder motility and bile secretion. In one of these studies, ginger extract was administered to subjects with and without gallstones. The results were determined by using an ultrasound to measure gallbladder motility. In addition to that, their bile secretion levels were analyzed. It was observed that ginger increased bile secretion by 35% and gallbladder motility by 20% in subjects without gallstones, exacerbating symptoms in 30% of those with gallstones. Number 5. Pregnancy. Even though ginger is a popular natural remedy, often used to alleviate morning sickness, high doses can potentially lead to uterine contractions and affect the development of the fetus. This is because ginger's active compounds can influence prostaglandin production, which may induce uterine contractions. While moderate amounts are generally considered safe, high doses that are over 1 gram per day have been associated with increased risk of miscarriage according to some studies. In 2001, a study titled "The Effects of Ginger on Nausea and Vomiting During Pregnancy" was published in the Journal of Obstetrics and Gynecology. In this study, pregnant women were administered varying doses of ginger. Their frequency of nausea and vomiting was monitored. Furthermore, the outcomes of the pregnancies were also monitored. The results revealed that high doses that were over 1 gram per day were associated with a 15% increase in the risk of miscarriage compared to low doses. Number 6. Heart conditions. Individuals suffering from certain heart conditions must stay away from ginger as it can affect blood pressure and heart rate, posing risks for them. Ginger's impact on blood pressure is dual, meaning that it can both lower and raise blood pressure depending on the individual's condition and the dose they consumed. Adding to that, ginger also has anti-inflammatory properties that can affect heart rhythm and blood flow. Studies suggest that while ginger can reduce cholesterol and improve heart health, its potential to alter heart rate and interact with cardiovascular medications warrants caution. In a 2005 study, ginger extract was given to subjects with and without cardiovascular conditions. All participants had their blood pressure, heart rate, and lipid profiles monitored. The results revealed that blood pressure was reduced by 10 to 15% in hypertensive patients, but heart rate irregularities increased by 10% in some subjects with pre-existing conditions. So, these were the health problems you should avoid ginger if you have. In conclusion, while ginger offers numerous health benefits, it can pose risks for individuals with specific health problems. Consulting with a healthcare provider before consuming ginger, especially in large amounts or as a supplement, is essential to avoid adverse effects. Now, we want to hear from you. Do you have any of these health problems? If so, what complications did you experience due to consuming ginger? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.